The reprocessing cycle moves from dirty to clean and begins in the treatment room post-procedure. Before leaving a contaminated area, remove all PPE and discard it before escorting the patient out. This includes removing the mask, gloves, and protective eyewear. Proper PPE is necessary for preparing the treatment room for the next appointment. This includes mask, jacket, protective eyewear, and gloves. Exam gloves do not protect against sharps and are not chemical resistant. Sharps container should be within reach of the seated clinician. Discard sharps into the container. Any debris, such as composite material, should be removed chairside to prevent drying and hardening on the instrument. If this is not done, it can be very difficult to remove during cleaning and it can become fixed onto the instrument. This can lead to corrosion and prevent sterility. Check that any hinged instruments are free of debris and placed into the clips in the open position for proper cleaning and to prevent corrosion. At this time, disassemble any assembled items, such as mirrors, and place into an appropriate accessory area. Discard any disposables, such as cotton rolls, gauze, or floss, in the operatory. If instruments will not be cleaned immediately, use a pre-cleaner, such as Enzymax spray gel, to begin the breakdown of any debris left on the instruments by keeping it moist until cleaning is achieved. Ensure instruments are in place and properly close and lock the cassette to transport it to the sterilization area. Disinfection and replacement of barriers will need to be completed. For transportation of contaminated instruments, all PPE, including utility gloves, should be worn. The cassette can be transported to the sterilization area a number of ways, such as placing the cassette in an organizational tub, placing the cassette on a tray with locking cover, or wrapping the cassette in its sterilization wrap that was used as a sterile field. The CDC recommends that the reprocessing area be divided into 4 sections to control quality and ensure safety: receiving, cleaning, and decontamination, preparation and packaging, sterilization, and storage. This flow from contaminated to sterile storage helps to prevent cross-contamination and promotes efficiency by following one direction, preventing unneeded back and forth steps. The receiving, cleaning, and decontamination area includes all equipment to help remove debris from contaminated instrumentation, supplies, and equipment, including an ultrasonic cleaner, automated washer or washer disinfector, the dental hand piece cleaner, and the sink. Follow the manufacturer's instructions on the proper use of the ultrasonic cleaner, type of water to be used, and the appropriate detergent. Proper dilution of the cleaning agent is important to ensure effective cleaning. Powder-based solutions should be completely dissolved. Change the solution at least daily or more frequently if the water is visibly soiled. Some busy offices or offices with long hours must change the solution multiple times a day. Hugh Freedy recommends the use of a dual enzyme detergent with corrosion inhibitors and chelating agents to remove proteins and starches, such as blood and saliva, while protecting the instruments and keeping them looking like new. Hugh Freedy's Enzymax detergents are tested and approved for use on Hugh Freedy instruments. When performing the cleaning step, the clinician must have the appropriate PPE, such as utility gloves, mask, jacket, and protective eyewear. Utility gloves should be puncture and chemical resistant and sized for optimal dexterity. Each clinician should have their own pair of utility gloves for proper fit. This area should only contain items that are contaminated. Place cassette into the ultrasonic cleaner on the appropriate rack. A basket or rack should always be used. Never place instruments or cassettes directly on the bottom of the ultrasonic cleaner, as it will damage the unit. There may be times that an instrument is needed that is not frequently used. You can place this instrument in the ultrasonic cleaner on top of the cassettes and pouch it separately later. For clinicians who do not prefer to separate ultrasonic inserts, an ultrasonic insert cassette with a finger mat can protect the delicate stack and allow the item to be cleaned in the same process. Cassettes and instruments should be fully submerged. Place the lid onto the ultrasonic cleaner to prevent spatter and aerosols. Never reach into the ultrasonic cleaner with bare hands or while it is running. Never add or remove instruments or cassettes during the cycle. Proper utility gloves should always be worn. When the cycle is complete, use the rack to pull out the cassettes and rinse thoroughly in warm to hot water to promote faster drying. Allow cassettes to dry completely before moving to the packaging step to prevent wicking, cross-contamination, and corrosion. In some cases, an office may use an automated washer or washer disinfector. It is recommended that a water quality test be performed before installing an automated washer or washer disinfector. There are units on the market that are approved for use in a dental practice. It is recommended to have an ultrasonic cleaner as a backup and for reprocessing items that cannot go into a washer. There are some types of materials or instruments that should not be reprocessed in a washer. A comprehensive document can be found in the resources section. If using an automated washer or washer disinfector, simply place the cassette directly onto the rack. Be sure to orient the cassette into the washer so that the rotating arm is not blocked and allows for proper distribution of the cleaning agent and rinsing steps. Follow the equipment manufacturer's instructions for proper detergent, cleaning, rinsing, and drying of the cassettes. When using an automated washer or washer disinfector, you can skip the manual rinsing step as described with ultrasonic cleaner use. Store all packaging materials in the preparation and packaging area, including sterilization wrap and tape, sterilization pouches, and chemical indicators or integrators. A steam sterilizer removes the amount of water that it introduces during the cycle. Ensuring that instruments are dry before sterilization is essential. Instruments and cassettes are still considered contaminated and proper PPE is necessary. This includes a mask, eye protection, a jacket, and a clean, dry pair of utility gloves. Wet gloves should not be worn. Open the dry cassette to check for any debris left on the instruments. It is recommended to avoid hand scrubbing, but if necessary, use a long-handled brush and utility gloves. Confirm that any hinged instruments are in the open position and apply lubricating oils if needed. Place a chemical indicator or integrator in the middle of the cassette. Hu-Fried's Class 5 multivariable sterilization monitors react to all critical variables in the sterilization cycle. You can also include any disposable items, such as gauze or cotton rolls, that can be sterilized with your setup. The cassette is ready for packaging. Utility gloves are still required. There are two ways to properly wrap a cassette. Let's start with the standard gift method. Lay the wrap flat with the cassette centered on the wrap. Bring up one half over the cassette, followed by the other side. Place a piece of IMS tape to hold it in place. Fold the sides like a gift. Bring each side in until you have a point or a triangle. Fold the triangle over on top of the cassette and place the tape. Be sure you don't allow any openings in the folds. Add a few more pieces of IMS tape to the sides for easy identification in the sterilizer and storage. Another option for wrapping your cassette is the hospital style. For hospital style, turn the wrap so it creates a diamond and lay the cassette in the center. Pull up the bottom half over the top of the cassette and tuck it under the cassette while leaving the corner inside as you see here. Gather each side as shown and fold over the top of the cassette. Place IMS tape to hold down both sides. Next, grab the top half, ensure the sides are folded in, and fold it over the top. Place IMS tape over the last folded piece to hold it all together. Lastly, add a few more pieces of IMS tape to the sides for easy identification in the sterilizer and storage. Write the date on the autoclave tape and indicate which sterilizer was used. Use a marker that will not bleed, such as Hu-Fried's ID marker. Sometimes pouches need to be used for loose instruments that are not frequently used. If using pouches, follow the manufacturer's instructions regarding the instrument capacity for the pouch size. Pouches should be able to lie with instruments flat and with a finger width of space on either side of the instruments. This prevents overstuffing, tears, and promotes proper sterilization. Place an integrator or indicator inside the pouch if the pouch does not have an internal indicator. Placing an integrator provides greater confidence even if the pouch has an internal indicator. Write the date on the pouch and indicate which sterilizer was used. This is for reference if there is ever a positive spore test. Write on the plastic side of the pouch. According to the CDC, the sterilization section of the reprocessing area should include the sterilizers and related supplies, with adequate space for loading, unloading, and cool down. Hu-Friedy products are tested and approved for use in steam sterilizers. Consult Hu-Friedy's validated reprocessing guide located in the resource section for cycle times and temperatures. Place cassettes into the sterilizer. It is recommended to use the cassette rack sold separately by the manufacturer of the sterilizer to allow for optimal capacity and proper flow through. Never stack cassettes directly on top of each other in a sterilizer, as this will prevent proper airflow through the cassettes during the sterilization cycle. If using pouches, optimal placement of the pouches should be on their edges and next to each other in a pouch rack. Follow manufacturer's instructions regarding loading of pouches in a single layer on trays in the unit. Some units recommend paper side up, while others recommend paper side down. Follow manufacturer's instructions to confirm cycle type to use for cassettes. Allow the sterilizer to complete its cycle and do not remove cassettes or pouches until the dry cycle is complete. All packages should be completely dry and cool prior to removal. Early removal can lead to non-sterile instruments that are still wet, which can result in wet packs, cross-contamination, or instrument corrosion and can put patients at risk. PPE is not required when removing sterile packs from the sterilizer. Hands should be clean and dry. Check the monitor tape or the indicators on the pouches to confirm the sterilization process occurred. Follow manufacturer's instructions for maintenance of the autoclave unit. There may be daily, weekly, or monthly maintenance needed. Sterile patient care items should be stored in a closed and well-ventilated area that will protect against dust and moisture. This will help to maintain sterility of the packages until ready to use. If possible, stack the cassettes vertically on their sides during storage to prevent crushing or tearing of the sterile packaging. No PPE is required when placing sterile items into storage. Hands should be clean and dry. Sterile storage can be date or event related. Event-related means that as long as the package has not been compromised in any way, such as tear holes or penetrated moisture, it will remain sterile indefinitely. If sterility is ever compromised, the contents will need to be cleaned, packaged, and sterilized again. Never store sterile pouches or cassettes above a sterilizer. Steam or moisture from the sterilizer may penetrate the package, resulting in a wicking effect, thus deeming the package no longer sterile. Organizational tubs may also be stored here to access single-use disposables that may need to be transported to an operatory or be used for patient preparation. It is ideal to have space after sterile storage for patient preparation. This prevents going backwards in the flow or getting in the way of others who may be performing reprocessing steps. Unless required by state law, no PPE is required during this step. However, wearing exam gloves in front of the patient is best practice. Hand hygiene prior to the preparation process helps to reduce the risk of cross-contamination. Identify the cassette needed for the procedure and select its matching organizational tub if it is not stored in the operatory. Appropriate PPE should now be donned before patient treatment. It is best practice to open the sterile pack after the patient is seated to provide assurance that the instruments have been sterilized. If using IMS wrap for the cassettes, this wrap can be used as a sterile field. While you would have already confirmed sterilization from the external indicator, always be sure to check the internal indicator when you open the package to ensure it is fully changed. Now you are ready to start using your new system. Hu4D support does not end here. Your Hu4D customer care specialist is available to answer questions and be a resource for you. In addition, the resource section includes helpful tools such as how-to videos and downloadable reference documents. Keep the IMS catalog for easy reference, as it is a great resource for part code and product information. The Hu4D website provides resources to you such as replacement rail part codes for your cassettes, educational resources such as free webinars, and much more.